Good morning and welcome back to the second in the series of videos that Simran Narang, health, weight loss and lifestyle coach, and myself, Daman Philip, relationship and ADHD coach, have put together to create an awareness of this very important topic, ADHD. Welcome, Simran.
Thank you, Daman. So in our last video, we discussed a brief overview of ADHD, the understanding of attention deficit hyperactivity disorder, and it has grown significantly over the last decade as we progress. The definition of ADHD is changing.
That's right. Yeah. We're aware that ADHD is a neurological disorder that impacts the parts of the brain that help us to kind of plan, focus, execute tasks. Like we had mentioned in our last video, ADHD is definitely not a behavior disorder. It's not a mental illness. It's not a specific learning disability. So, Simran, today let's endeavor to create an awareness of this disorder so it's recognized and it can be managed timely because cases of ADHD have the potential for continuity into adolescence, into adulthood as well.
Totally. And its presence also increases difficulties in the academic performance and social interactions. So, what I have read is that ADHD affects approximately 6 to 7% of children globally.
Yeah.
And it's a disorder that can affect persons' everyday functioning,
Hmm.
even until adulthood. So, unlike like the common misconception that it naturally goes after childhood, and as such, children suffering from ADHD, and I'm saying this because I've observed it in India, kids do stand a risk of long-term negative outcomes like lower educational attainment and loss of jobs or no jobs at all in
That,
adulthood.
yeah, that's true. That's true. And adding on to that, Simran, I like to add on over here is now that you have mentioned India, it is believed that an average of 3 to 4% of India's population suffers from major mental disorders. I was reading the other day data from the National Mental Health Survey has revealed that in India, common mental disorders, like you look at depression or you look at anxiety disorders or even substance use disorders, these are a huge burden affecting, I believe, nearly 10% of the population today.
Yeah, and therefore, like an identification and an awareness of managing it is so critical. So, today I just want to touch upon three subtypes of ADHD. So, the first type is the inattentive type.
Yeah.
And in this type, some of the common symptoms to watch out for are like failure to give close attention to details or making careless mistakes in schoolwork or work or other activities, difficulty sustaining attention, and failure to follow through instructions, and
Yeah.
then fail to finish schoolwork on time and chores,
Hmm.
and in organizing tasks and activities, and easily distracted and like forgetful in daily activities.
That's right.
And
Yeah.
the second type is the hyperactive or the impulsive type.
And symptoms to watch out for the second type, which, as Simran said, is the hyperactive or the impulsive type, is you often see them fidgeting a lot, squirming, or talking excessively for that matter, running about excessively in situations in which it's inappropriate, or there's difficulty playing or engaging in leisure activities quietly. What I've also noticed is a lot of interrupting, or you can say when people are talking, they tend to intrude on others. They blurt out the answers before the questions have been completed. A kind of,
Yeah.
these are the types that seem to be kind of, on the constantly on the go, hyperactive, driven by a motor kind of thing, you know.
Right. Yeah, true. And the third type is the combined type. So this is the most common type of ADHD, and like people with it have symptoms of both inattention and hyperactivity as
Correct.
well. Yeah.
Yeah. And so, if you recognize yourself or your loved ones having more than at least 6 of these ADHD symptoms, and the symptoms, they persistently disrupt life in multiple settings, we do suggest that you connect with your medical healthcare professional or an experienced ADHD coach for a diagnosis.
Yeah, and I like to add that there is no single test to diagnose ADHD. So we as ADHD coaches, we rely on several things, including interviews with parents, with the relatives, with family members, and like personally watching the child or adult behaviors. Then there are questionnaires or rating scales that measure the symptoms of the ADHD,
Yeah.
and psychological tests are there, and so many other things, right? So doctors also sometimes may use the rating scales to help them evaluate and then track the ADHD symptoms.
Yeah. And, Simran, clients often ask me this particular question, if ADHD is completely curable. And to those who have this question, I'd like to say to them that ADHD symptoms rarely disappear with age. However, having said that, ADHD can be managed well if it is diagnosed and treated in a timely manner.
Yes, and I remember you mentioned this to me with some of your ADHD clients as well who are teens.
Yeah, some of the adults might feel honestly, that it's pointless to pursue a diagnosis if ADHD with ADHD if it hasn't kind of stopped them from either getting married or pursuing a career or having children or whatever. But what one doesn't realize here is that unmanaged ADHD can eventually cause, things like job loss, relationship conflicts, or for that matter, substance abuse, amongst other things.
Yes. A disclaimer here that we are not psychologists or psychiatrists or therapists. While medication may be required in cases, and I strongly advise like parents and adults to seek therapy as a part of this treatment plan, our job as coaches is to empower the clients with structures and skills, planning and time management, and goal settings,
Yeah.
and motivation so that they can better cope and manage that condition well.
Yeah, true. And as disruptive as ADHD can be to your academic, professional, and personal success, there are many ways to make the condition work for you in your favor rather than against you. And so,
Right.
on that note, here are some of the many awesome folks with ADHD who are crushing it daily.
And on that note, reaching out for support is the best strategy. So if you are confused, you need some help, reach out to us on the link in the comments. We just might be the support you have been looking out for. Until then, stay safe, be wise, and action timely.
Bye bye. Thank you.